I'm going to start with a review of anatomy. We're going to start with our distal femur. This is a left femur, and we're going to go from medial to lateral. Most medial, we have our adductor tubercle. We have our medial epicondyle. We have our medial condyle, which again extends further in that anterior posterior direction. So remember that as we get to the screw home mechanism next. We have our intercondylar fossa here in the middle part. Now we go to our lateral condyle and our lateral epicondyle. We're going to continue our discussion of anatomy with the proximal tibia. We're going to go from medial to lateral. We have our medial tubercle here. We have our medial tibial plateau and condyle here. We have our tibial tuberosity in the middle on the anterior aspect. We have Gerdy's tubercle over here on this lateral condyle. This is our lateral condyle, lateral tubercle, and our intercondylar eminence right here in the middle. I also want you to note how much larger that medial tibial plateau is. Again, thinking about that when we get to that screw home mechanism. On the posterior aspect, we have our soleal line running to the posterior aspect of our tibia here. Next up, we have our kneecap or our patella. It's an inverted triangle, so you have your base on top and you have your apex on the bottom. This is a left patella because the lateral facet is much larger than that medial facet. So that's how to always know which patella you have. Look for the larger facet that always goes on the outside. So if I have a lateral facet on looking like this, as I turn it around like a real kneecap, that's going to be on the outside for a left patella.